to throw. There was no, symbolic representation. There was no intentionality. There was no. I feel like it was really severe. And so, how to assess and how to target goals for something that's. Am I making sense at all?
Yeah.
Okay, so
I'm letting you talk, but where?
It's not just.
What do you think? Where do you think you should start if you have a child like that? Get that already.
Okay, symbols and picture identification doesn't work because they don't understand symbols.
Still, yeah, your comment.
Oh, I don't know. When you said where to start, I was going to say with intention, maybe.
Yeah, but
if you do joint attention, there's not reciprocal communication.
Yeah, if you have a child kind of sometimes who plateaus and ends up maybe not getting the best intervention along the way, say, or again they're just just more severely involved, and their capacity to attend and interact with others just remains limited. Okay, and that can happen. They don't make progress with social engagement and social interaction with others. The thing is, with kids with autism, in that they don't learn well from us, and that's the key for you kind of sometimes to remember. Some kids do. I'm not saying all kids with autism, but a lot of kids who are more severely involved, more severely presentation of autism, is that they don't then learn well from other adults. Okay, they can't imitate. Okay, that we try to teach them or trying to get them to imitate the language we're producing, or imitate even actions or play or other kinds of things that we show them, because the attention isn't there. Okay, and the ability to engage with the other person and watch what they're doing and absorb that information. Okay, kids, who are more severely involved, they have difficulty with that, so they end up not learning. Do you see then the result of what happens there? So going back to, obviously though, they probably have preferences, okay, and able to make choices. So going back to kind of our earlier conversation is that you're starting there, okay, with real objects, making sure they have choices throughout their day, okay. Then you may set up either a kind of PEC system or some kind of choice making, using Go Talk Now on the iPad, okay, to let them know they have some control, okay, during their day over some choices. Okay, they may need a strict behavioral-based program to work on behaviors, such as, like you're saying, they were throwing things or not attending or having behavioral issues. Then you need a behavioral intervention to work on those behaviors.
You mean that the ABA stuff? Right.
Yeah, but it's not. I'm not saying discrete trial. Okay, so when you say ABA, okay, ABA is a big name that's thrown around and kind of misused. So what I'm recommending though is behavioral approaches and intervention to work on maladaptive behavior like throwing and those kinds of things. Okay, so, and that's, again, if you have access to a behavioral specialist wherever you're working, if you're working with that severe population, hopefully they have someone, within that setting to do a behavioral analysis. Okay, they're certified BCBAs. They're called. They're titled Certified Behavioral Analysts. But yeah, to go back to that, you kind of have to go back to the basics. And then again, children with autism, they do very well with structure and schedule. Okay? So to kind of get into some of the things, other things I have posted in this week, the importance of having visual schedules, okay? And to help the child understand what's going to happen next. Because a lot of kids with autism, they end up having a lot of anxiety because they can't process information the same way normally developing kids. So when you give a direction, a teacher gives a direction, okay, in 5 minutes, we're going to get ready and go to art class, okay? So a kid with autism hears that, they're not processing that, okay? And then all of a sudden, in 5 minutes later, they see everyone get up, and then they get upset. What's happening, So, the importance of having visual picture schedules, for a child with autism, that's one behavioral approach to kind of help them, understand their day.
This child, we observed for the project was the sensory motor abilities. The gym, he shined in ways much more than trying to be like, I had an idea for kind of like a constructivist activity, building train tracks, which didn't work. But in the sensory motor abilities of like the gym they had,
right.
That's where they did a lot of work with him.
Mm-hmm.
It's told from the PT. So
right.
I was like, wow, that's it. It was interesting.
Yeah. So kids with autism, they have. I think I have on one of these slides here talking about sensory and motor issues, obviously. And some kids really enjoy those kinds of activities. Okay, so if you have a kid like that, that's them. Now, okay, you got some of your preferences. You got some things they can have choices over. Okay, and that might be turned into a reward that they do certain desk work, and they're working towards time with the physio ball or time to do jump on the trampoline and those kinds of things to get more sensory breaks and input. Interspersed with some desk time or work time.
Sorry, I didn't mean to you.
That's okay. All right, so just a couple comments about, again, echolalia. In that, obviously, depending on what type of echolalia, if it's immediate or delayed. Okay, so if it's immediate, where the child's repeating back the question you posed or the words that you've said, okay, and they're just immediately just repeating back. Obviously, they're hearing you, okay, and they're hearing what you're saying, okay, but it could be then that obviously they don't have their ability to pull their own vocabulary to respond to you. Okay. So some of the research says is that they're just they're hearing the language and they're repeating what you've told them as a way to respond and answer, because again, they're not able to then pull their own novel information, their own novel words to then reply back. See, so they say, there's certain positives about echolalia and the fact that the child's trying to respond to you or say something to you. It's not right. It's not what you're looking for as a response, but it's a sign, obviously, that they can speak, they can produce language, and it's something, that you should continue to try and work on to then structure your situations where the responses are narrowed. They have to respond with certain words, okay, in order for something to happen, some kind of consequence or kind of more structured kinds of activities to then force some of those responses versus open-ended kind of yes-no questions where you might get more echolalia kind of responses. Okay, so another kind of good sign that you may see kids do is kind of to show you that symbolic skills are emerging, okay? In that a child may go get something in the environment and then bring it to someone to make a request. So the example is getting the car keys and then handing it to a parent or somebody in the house to request to go in the car, go for car. Okay. So if a child is going and getting things in the environment and then giving to an adult to make a request, that's really good. So you may hear per parent report that kids are doing those things. So that's, again, a great opportunity to start intervening now with some photographs, PECs to represent those items or those things the child is trying to request, to try and bridge that gap over to some more symbolic ways of communicating. Another example, again, a child may put the adult's hand on the door to ask to go out. Okay, they may sing a part of a song. okay, to request that video, you know, or to sing the song, okay. So these are all good signs that simple skills are starting to emerge. Communication is progressing, and this is ways we can now start intervening with AAC. So there are also good signs too, because normally developing kids do this too before they start talking and using a lot of words or have the vocabulary to communicate. Young toddlers, you know, also do these kinds of strategies. Okay. So again, us as SLPs, we want to provide a AAC method, okay, in these situations where these kids are doing these reenactment strategies, okay, to see if we can again bridge that over and increase their symbol capacities. Some kids, if they're not supplied with some AAC techniques right away, they may end up plateauing with this type of requesting, okay. And again, if they continue to plateau with their cognitive and symbolic abilities, you may see more of these behaviors, you know, as part of their communication repertoire. So the biggest thing though with this is that it's an emergence of communicative intent. So they're really intentionally approaching others. They're trying to make requests, okay? And they're making requests. So I always say these kinds of behaviors are signs that the wheels are turning, okay? In that kids have thought, they're thinking about, oh, I want to go in the car, I want to go outside, okay? So they're having thoughts and thinking about things that are still out of context. So it's showing signs of object permanence. Okay, so these are good signs, okay, of cognitive development when kids are demonstrating some of these behaviors. Okay. All right, so just a couple comments here about, I'm going to kind of briefly mention about behavioral interventions for maladaptive behaviors or undesirable behaviors. When children with autism, again, engage in some of these negative behaviors, yes, you know, if they could communicate better, maybe they wouldn't be, you know. But we know that if we look at still normally developing kids, the terrible 2s, okay, and the 3s, okay, we know kids throw tantrums, okay, but again, a lot of these kids with autism, they're very severely delayed, so they may be demonstrating some of these behaviors that 2- and 3-year-olds, you know, demonstrate, in that their level of patience and tolerance for things are very low, a lot of times, okay, and they, because of the communication impairments, you know, they don't communicate right away what is wrong necessarily, okay? But it's not, my point is, it's not, they're not throwing tantrums or having these negative behaviors solely because they can't communicate, okay? They're demonstrating these behaviors for a reason, okay? Because sometimes, again, it's to get attention, escape a certain situation, okay, avoidance of tasks, okay, you know, so a protest, okay. So a kid could then still use language, say, no, I don't want to do this, you know, and still throw a tantrum. Do you see what I'm saying? Because they're forced, they're doing, you know, asked to do something they don't want to do, okay. So that's my point. So a lot of times when you're dealing with some of these kids who have these kinds of behaviors, people are quick to run down the hall to the SLP, or quick to then, you know, go to the SLP to say, you know, Johnny's acting out and having all these behaviors because he can't speak or he's nonverbal. And, we, you know, you as the SLP, we need to do something. So my point is, after what I've just said, it's, yes, we can work on some things, okay, but even if the child could speak and say, like I just said, no, I'm not getting on the bus. No, I'm not doing this, you know, or can still say it and still throw the items and still have a tantrum. Do you see what I'm saying? Okay, so it's not the fact that the child can't communicate. Okay, so use that example when you have people running to you as the SLP, okay? Because there was so many cases, and I've worked in schools in New Jersey, specialized schools for children with autism, and it was so many times they would kind of look to the SLP because, again, the child had severe communication impairments, you know, as the reason why, okay, the child has behavioral issues. And there's lots of reasons why the child's having behavioral issues, you know, not just the fact that they can't communicate. So, so that's sort of, you know, what I wanted to kind of reiterate there. It's good to provide still communication options to head off sometimes of behaviors or give choices that the child can choose. So if they don't want to do this, okay, your option is to do that. You know, and they're still viable choices. So the child feels like they have some control. So that may help with the behaviors. Okay, so what I'm saying is, yes, you still should provide a modality of communication, but, you know, that may or may not help, you know, with the child's ability to accept undesirable tasks or engage in things, you know, they don't want to do. All right, so you know about symbolic and pretend play. This is just a reference for you for an assessment tool if you're working with this population and you need something specific for this to evaluate children with autism. This is a good one. All right, so again, just some comments here in that I think it's gotten better. I think more knowledge is coming out about this disorder. Okay? A lot more research is coming out. I think people have a little bit better understanding about the disorder than they did years ago. But I still get some statements and use of apraxia as a diagnosis for kids with autism who are nonverbal. So if you have a child who's nonverbal, do you think you can legitimately use that diagnosis of apraxia? How can you assess it?
And even the generalizations.
What's that?
There's probably no generalizations.
Yeah, you're guessing, right? So don't do it. Okay, so don't use the diagnosis or assume that there's a speech motor impairment when you can't even properly assess when you know, the child is nonverbal. You know, overused. It's like I said, I think it's getting better, but for a while it was just so overused. So yeah, what we know now is that, again, if a child with autism, you know, it's possible they do have some motor programming and planning issues. It's very possible, but we don't know. We can't slap on a diagnosis if we don't know. So it's possible, okay? But it's also, again, very possible that all those things we just talked about their capacity for language and symbol use, okay, and learning language from others, okay, is impaired. And that's why they haven't acquired language, okay? So that's why they're not speaking, okay? Because, again, they're not able to acquire language receptively and learn language from others due to lack of joint attention, lack of attention and awareness of the environment, and be able to hear words that are modeled by others, okay, and tagging those words to those life experiences. Okay, so that's how normally developing kids learn language. So children with autism are not learning language in that way, okay, and that might be the reason why they're not speaking. Okay, so so again, we can't use apraxia as a diagnosis for that reason. Okay. So what we see, though, is that I think why some people kind of tend to want to use this diagnosis, but we see, though, children with autism sometimes have a lot of fine motor difficulties. Okay, so they don't progress with writing. They have a lot of difficulty with fine motor activities. Though gross motor activities, like Peter was mentioning about his observation of the particular child liked a lot of gross motor activity. Okay? So I know the kids I worked with, you know, they like the playground and like running around and doing those kinds of gross motor activities. But fine motor is often problematic. Okay? Also, just to point out, these are diagnostic indicators, and especially, you know, for those of you who are doing 614A at some point, we look for these kinds of comments by parents because we get a lot of kids who sometimes, you know, are showing early signs of autism in that they comment that the child did not crawl. Okay. They went from sitting to standing and then walking. So they missed crawling. Okay, so that is a big flag of not following a normal developmental sequence. Okay, crawling is very important, obviously, for other reasons, you know, a PT could explain, but for reasons of exploring your environment, okay, and learning, okay, crawling is very important for cognitive development, okay, and be able to interact with items and things. Once a kid starts walking, I don't know if you know, like toddlers, that's like all they want to do, you know, and they're kind of focused on that motor activity, and walking becomes then running, and you know, they're hard to get them to attend. Okay. But that stage before they start walking is that when they are crawling and they're sitting and they're doing a lot of joint attention and engagement, okay, with parents, and so they're learning a lot of language. Okay, a lot of cognitive development goes on there. So if they're missing that piece, okay, that is also something we want to know. Okay, where am I? All right, so these are just a few then slides to kind of reiterate what I've been talking about. All right, so some reasons why, again, kids with autism rely heavily on gestures, okay, because they're gesturing, communicating about things here and now. It's in context. Okay? They may have difficulty with object permanence and talking about things outside of the environment or outside of the context. So, in that instance, obviously you're going to try to capitalize on their gesture skills. Okay? If you have a child who is plateauing and not making that bridge over to some forms of symbolic communication. All right, so we want to make sure that a child, and this is all kind of relating to what we were talking about earlier about establishing communicative intent, okay, and using AAC, is that they do have some type of gesture and indicator of preferences and things in their environment. So it might be eye gaze, it might be, you know, gesturing towards the real items or things in the environment. We want to see a kid doing that, at least, before then we start intervening with symbol forms of AAC, okay, because we're going to use as a backup to test them, like we said, and to do symbol correspondence checks to make sure that then the symbolic forms that we're introducing are matching their non-symbolic ways of communicating, okay? All right. So some some of the very basic, okay, communication strategies we've been talking about. Gaining attention, making choices, okay? So communicative intent, being able to get another person's attention, okay, to be able to communicate things in the environment, or again, making choices within their environment with real objects. The requesting more, you have to just be careful with that, in that you always have to tag more and then the item that they want more of. Okay, so if you're teaching or using the sign for more or a continuation of something, it's more what? More cheese, more orange, more drink. Okay, you never want to teach more by itself. Do you know why that would be?
We could be related to anything, or connecting it to anything.
Right. So then when the child wants more of something, then they're just doing this, and then the people don't know more of what. Right, and they end up walking around and doing that sign thinking that everyone's going to understand then what they want.
Yeah.
Right. So
It should be to a specific thing.
right. So I'm not saying you can't teach the concept of more or the sign for more, you know, to request continuation of something, but make sure you're tagging it then with the real object. Yeah. So that's just one thing you have to be careful of. So some manual signs you may consider that actually kind of mimic the action that you actually do. So the sign for eat, you know, you bring your hand to your mouth when you're eating, okay? The sign for drink, you know, you still do that, you know. So some kids, they do this for all done because it's like you want to clean up and wash your hands and be done with it. So this sometimes works well for all done and clean up versus this, you know, for all done. Some kids who just have fine motor difficulty with sign, and it ends up like this for all done. I do stop. Two hands like this, so it's very concrete, and there's no like hand waving that kids kind of get crazy with. So for all done or finished, it's stop, this. So those are just some tricks to try to teach some basic communication with signs. All right, so some kids with autism, they really progress with signs, okay, and they end up being idiosyncratic, or kind of made up their own signs for things. So, which is good, you know, because it's showing, you know, they're growing with their symbolic skills and communication skills. And signing is quick and easy. It's like speech. We use our own bodies. We don't need a thing or an aid or a textbook or going and finding a symbol or using our iPad to find our words, you know. So, so if a child has the capacity to learn some signs, I would still teach that as part of their AAC system, okay, and modality to communicate. One thing though, I have some kids who really prefer to sign because they don't like the time it takes. We talked about the time it takes for an aided AAC system to find your words and to use it for communication. Some kids with autism don't have the patience for it, so they end up progressing more with signs because they like it better and with the speed. But just keep in mind that obviously unfamiliar people may have difficulty understanding the signs, okay, who are not familiar with that child. And one, though, recommendation is to have a gesture dictionary. So you can take photos of the child doing the various signs, okay, and then print them out and put it in like a dictionary. So then people who maybe aren't as familiar, or have a babysitter coming or something like that, or grandma, grandpa coming to visit who don't maybe know all the signs as much, they have something to fall back on to, you know, understand the different signs the child's producing. So that's one idea to address that issue. All right, so our big question is electronic or manual PECs or device, obviously, when we're looking at AAC for a child with autism. And it's really, it's unique to the child. So we kind of sort of talked about that when I talked about PECS, you know, earlier on, in that it's not the end-all be-all for every kid with autism. Yes, it works well for a lot of kids to get them communicating, you know, who are diagnosed with autism, but I still work with some kids where they don't make progress with PECS, okay, because they don't kind of get that reward or feedback when they do the exchange. They could care less about interacting with the person. It's just not motivating. It's too slow. It requires a lot of work to scan the symbols, pull it off, hand it to the person, and then get my item. It's just way too slow. So we kind of really need to look at what is going to motivate the person to want to communicate. Okay, and sometimes then if you have a child like that who's not motivated by PECS, or it's just taking too much time for them to communicate with that method, then we might consider then the iPad, okay, with maybe the Go Talk Now app, something basic for choice making where it's very quick, okay, that they can make a selection. It speaks, they like the auditory voice output feedback. A lot of kids who really like that feedback, to hear the voice and then, you know, use that for communication. So those are the things that I look for. So it's really, you're looking at which feedback mode seems to work best, okay, for the individual under different kinds of circumstances, okay. And then again, some kids, the voice output feedback works better, okay, and they're more motivated by it than, say, a PECS system. On the other side of the coin, then what kind of kid do you think then should use PECS versus electronic? To flip it the other way.
Someone
Go ahead.
doesn't have issues with, I don't know, someone who doesn't have,
Overstimulating?
I guess electronic would be,
Like the iPad, you know, with say the Go Talk Now app. What kid maybe would you not make that recommendation for, and maybe want to keep them on PECS in the system?
Kind of, I was thinking about the client that I have right now that his language abilities are kind of well undetermined right now, but
Right.
seem low. So I would introduce iPad or Go Talk Now app to him at all, and still keep like a PECS. Well, we have a PECS board that we use that has only 3 items for
Okay.
him to choose from.
Okay.
As opposed, I couldn't imagine giving him an iPad. So that's kind of what I was looking at.
It's too distracting.
Yeah, like it already has difficulty focusing, and like his language abilities are, I don't know if he would be even able to like, yeah.
Yeah. All right. So you have all those concerns, yeah, and about his attention and those kinds of things. So, and those are valid concerns to maybe. And then if he's still able to make progress with PECS and make choices in that way, and he's doing well with that, then keep going. You know, so that's fine. What maybe are some other issues with kids using electronic or iPad forms of AAC that would stimming, like what?
They become just clicking the buttons, kind of is just all they're focused on and nothing more.
Okay, right. So they're, yeah.
The feedback they're getting from that.
Right.
And it's probably for the bad, not for the good.
Right. So they have, we have called negative behaviors with the iPad, in that they're repeatedly touching the buttons, clicking the home button, wanting to go and swipe the screen repeatedly, wanting to search for YouTube or a particular app, you know, that they're used to using. So if they're using the iPad for leisure purposes and, you know, other apps for gaming, and then, you know, they're having a hard time making the transition of then using the iPad for communicating, okay, so that might be, you know, So yeah, so with those kinds of kids who have difficulty understanding, then the iPad's going to be a tool for communication. Then we may want to keep them on PECs, for a while.
I guess you can control PECs.
What's that?
You can control PECs.
Right. It's more adult controlled. Right. Yes.
You can give them choices.
Right.
When they get choices on the, but they get way too many choices.
Yeah, I mean, you can control the choices on the iPad. So, for instance, I'm going to keep mentioning Go Talk Now because we do use it a lot for kids with autism to introduce choice making. But you can only have 4 choices. So we really can limit it down, and then we can hide another cell. So you could mimic the 3 choices, say for the child you're working with, and with the Go Talk Now app. It's possible. But again, if you have a kid who's used to using PECs as that communication modality, and then you introduce the iPad, it might be very confusing to him, so those kinds of things you have to consider,
So that usually doesn't happen, where you move on from PECs to iPad.
No, you can, but since she's just getting going with PECs, it seems like, and she's just kind of establishing functional forms of communication, I would go with that for a while, until you get more success, maybe expand the field size a little bit, then maybe introduce the Go Talk Now later. Down the line, maybe, another 6 months or something. You could see where you're at, yeah.
Maybe a 2-way panel, too.
What's that?
Maybe a 2-way panel, like with the PECs thing, would that help too? With the kids with severe, you could do hearing the auditory, like on a 2-way panel voice output. You put the symbol with the dog, picture of the dog on your voice saying dog button, and then you put picture of the horse on the other button, and you speak horse into it. So they're also hearing, but I don't know.
There is a device, it's called the Pro Talker, that actually does what you're saying.
But
I don't know a whole lot of kids who ended up going there, because if they are responding to voice output, then a lot of times you can transition them over to the iPad, and just end up using touch, and they kind of learn that pretty quickly. There is a device that when you pull off the icon, it speaks. So it was made specifically by a dad for his child who has autism, who couldn't make that transition over to touchscreen because of some issues with understanding it's a communication tool and wanting to use it for gaming and those kinds of things, that he still wanted to have his child have voice output as a way of communicating, so he made this device for his, so called the Logan Pro Talker. So his son is Logan. So if you Google it, you'll find it, and that's what it does. So it's PECs where you pull off the symbol, you can then exchange it and give it to your partner, but it also speaks as you pull it off. So there is something like that out there. But yeah, I'm not quite sure if that's exactly what you were explaining.
I was also, thinking, but we don't know.
Would you want, you're saying you would want the child to then put the icon on to a piece of electronics?
Well, if they were doing choice-making, simple, concrete things.
Yeah, you don't want to introduce another
modality
demand that's not communication related when you're trying to teach expressive communication.
Right,
you kind of want to keep it, pull up the icon for a cookie, hand it to your communication partner, and you get the cookie. Okay? So you want to kind of keep that exchange going. Yeah, you don't.
That would be more for comprehension.
Because there is a formal protocols for PECs, even though, us the clinicians, sometimes we don't follow the formal stages necessarily, because some kids, you don't have to, we're just doing more of exchange-based methods, but there is a formal protocol for PECs, okay? You go through stages starting at phase 1 all the way through stages 5 and 6, okay? Where you're doing some sentence creation, like the one child you're working at, I want ball and ear bubbles or whatever, so, there is that out there, just be aware of those spaces.
I'm guessing those phases are probably just the PECs website.
What's that?
The phases are probably just...
Yeah, I think I have it in Blackboard. Did I put in information about the PECs and the phases?
Not that I saw.
Let me flip here. Just let me quickly look. Here, PECs instructional video. Okay, so go there and look at that. That shows about the phases of PECs and more the formal program that you can follow. It's a YouTube video. Yeah. All right, so we meet again next week. Right, so I'll kind of finish up with some of these extra new methods of intervention now for children with autism when we meet next week. Okay? All right, have a good night. Thanks.